osteoporosis is really a loss of bone mass. In other words, it is bone that no longer is as strong as it should be or as strong as it was in younger ages. It can be caused by a lot of different things. Bone is a constantly turning over organ. In other words, it's not just like a dead piece of chalk. It's something where cells are constantly making and breaking down tissue. In osteoporosis, there's just less making and consequently gradually more breaking down. So the overall mass in the bone lessens over time. Osteopenia, which is really a loss of bone mass, can then become osteoporosis, which is really less bone mass with a higher risk of fracture. And of course, that's the typical clinical endpoint of importance, whether a patient fractures a bone. And that can occur with advancing age. It can occur from use of certain medications like steroids. It can occur from loss of certain hormones, especially in postmenopausal women.
Common symptoms for osteoporosis as well, starting with back pain, loss of height over time. Some of these you have mentioned. So talk to us a little about these, Dr. Tolchin.
So the back pain, as I mentioned, when you start developing osteoporosis, your posture changes, you get slumped over. And so that puts strain on the ligaments around the spine. It puts strain on the small joints in the back called facet joints. It puts strain on the disc. So that's all reason to have back pain. And then as those bones start compressing down, if they do it subtly, it's not so painful like a compression fracture, the last item on the list.
Right.
But it may happen over time. People say, I'm shrinking. And usually women will say, I've lost height, I've lost an inch or two. And that's because of the osteoporosis starting to shrink those bones and compress them with time. And then they have the back pain, the stoop posture, and ultimately can have a fracture if it's bad enough.
Osteoporosis is when your bones deteriorate, putting you more at risk for fractures. Your bones protect your internal organs, store minerals your body needs, and give your body structure. Your bones are alive, and in order to stay healthy, they need calcium, protein, phosphorus, magnesium, and vitamins A and D. Your bones take most of these vitamins and minerals from what you eat and drink. Your bones are constantly being repaired and reconstructed, and new bone is always being formed. Cells, called osteoclasts, dissolve your damaged bone, leaving tiny holes. Once the damaged bone is removed, cells called osteoblasts take calcium from your bloodstream and fill the holes with new, healthy bone. Osteoclasts and osteoblasts need hormones in order to work properly. If they can't get enough of the hormones they need, they aren't able to repair and rebuild your bones. This is one of the main causes of osteoporosis. Other causes of osteoporosis are not getting enough vitamins and minerals, poor eating habits, and not getting enough exercise. If you think you could be at risk for osteoporosis, talk to your doctor.
Make sure that anyone at risk or with osteoporosis is on a good diet with calcium and vitamin D. We know that vitamin D is good even without osteoporosis in the elderly because it prevents falls, which is a huge thing for osteoporosis. So that's a diet component. Then there is a fall prevention component because if you fall and you have osteoporosis, that's a setup for a fracture. And that could mean a home evaluation, working with family members, working with the patient to make sure that there are no hazards like carpets that patients can trip over and things like that. The next thing that needs to happen is, work on the patient functional status, make sure that the patient is fit, can walk, if they need a cane or another assisted device that we provide that for them, again, to prevent falls. And then we go into exercise, and there's data to support weightlifting. It doesn't have to be a lot of weight, it can just be like light weight, but some form of resistance to improve bone health.
Some ways to treat osteoporosis, first of all, are some lifestyle modifications. Calcium and vitamin D are great supplements for everyone to take, even when you're young, as you can build that peak bone mass up till you're about 30 years old, and then it helps you kind of maintain that. And then there are some more prescription strength therapies that people will take, including the Fosamax or the bisphosphonates are the first line of treatment. But sometimes people don't tolerate those as well, and there are other types of medications such as some hormone replacement therapies and something called Forteo, which actually helps you build bone mass as used as a kind of last line therapy for patients that are not tolerating other options.
Hi, my name is Annette. I'm a physical therapist at the West Florida Rehabilitation Institute. Did you know osteoporosis affects 55% of Americans over the age of 50, in which 80% of those are women? It also contributes to 250,000 hip fractures annually. Here at West Florida Rehabilitation Institute, we offer a comprehensive osteoporosis program to assist anyone with osteopenia, osteoporosis, or even hip or spinal fractures. This includes site-specific exercise program, improving balance, promoting good body alignment, teaching good body mechanics during activities of daily living, and implementing a walking program. Our goal at West Florida Rehabilitation Institute is to provide you with proper education on osteoporosis and improve your quality of life.
Number one, when you're side lying on the mat, you not only get balance work, but you get abdominal strengthening, you get hip strengthening, you get low back strengthening, all in this wonderful package. And it's an incredible exercise to start thinking about coordinating that sensation or that relationship on your side and what you feel around your musculature to when you do come up in gravity, in standing. So it's an amazing exercise and a little bit sneaky. You might not think that it's a balance exercise, but it is. And number two, the 4-point kneeling or bird dog, it's an opposition exercise. So you're balancing on one knee and one hand. And it really actually echoes how we walk in real life. You always have one arm forward and one leg behind you. So when you do it on the mat, in a mat class, say, you are training your sense of balance on just two limbs, oppositionally, and balance side to side. So some of you know what that feels like. And the third one you can do anywhere. You can do it in the kitchen while you're making coffee. You can do it while you're doing dishes. You can do it while you're brushing your teeth. Talking to a friend is just simply, as you're standing on 2 feet, just lift one of them up and see how long you can stand on one foot. If you know yourself to have poor balance, do it near a wall. Hold on to something when you do that. But those three you can do every single day. You will improve your balance. You are loading your bones. It's weight-bearing exercise, and you're strengthening your bones. So there's lots and lots of things that you can do if you have osteoporosis or low bone mass.
Calcium is very important for the formation and strengthening of the bones. Hence, make sure to eat foods like milk, yogurt, cheese, cottage cheese or paneer, tofu, soya, pulses and beans regularly. Also consume broccoli, celery, almonds, sesame seeds, finger millet or ragi and fish. Magnesium-rich foods like spinach, flax seeds, pumpkin seeds, sunflower seeds, cashew nuts and soybeans work closely with calcium and will help you keep away from osteoporosis. Eat vitamin D-rich foods like fortified milk, butter, cheese and eggs, as they help the body to absorb calcium in the gut. It's advisable to avoid excessively salty foods, carbonated beverages and caffeine, as these all contain phosphates that leach calcium from the bones. Also, refrain from drinking alcohol, as it interferes with calcium absorption. Finally, ensure to soak up the morning sun for fulfilling your vitamin D needs. Eat well and take care of yourself. Goodbye.